We know that young women who are treated in adolescence with radiotherapy to their chest for lymphoma have an increased risk of developing breast cancer later in life. So we undertook this study to evaluate the extent to which the early initiation of breast cancer screening in young women who'd been treated with chest radiotherapy might reduce their risk of developing and of dying of breast cancer. We gathered together all the published information that we could find about the risk of developing breast cancer, the accuracy of different forms of breast cancer screening, the rates at which women agree to be screened when asked. And we put them into a mathematical model that basically calculates the chance that a woman's life will be saved if she is offered early breast cancer screening, having had prior chest radiation therapy as a teenager. So what we found is that you would have to invite about 80 young women for early breast cancer screening using MRI in order to prevent one breast cancer death. The clinical work that we had done demonstrated that MRI detects breast cancers in these young survivors, that MRI detects most of the breast cancers in these young survivors as compared to the mammograms. What this paper shows is that making any reasonable assumption about the nature of breast cancer in these survivors, that the early initiation of screening is likely to save lives. One finding was that adding MRI onto the screening protocol at a young age increased the risk of so-called false positives. So an MRI scan is so sensitive, it detects lots of changes in the breast tissue, most of which in fact is not cancer. And so our model suggests that from the age of 25 to 39, that about 1 in 3 women will have a false positive. And that as the screening protocol gets extended to age 75, that almost 80% of women screened with MRI will have at least one false positive. And so this is important to know and to counsel patients about. I'm David Hodgkin. I'm a radiation oncologist at the Princess Margaret Cancer Centre.